This program was produced by and first broadcast on Radio Kidnappers, a volunteer-based community access station. For more information, go to www.radiokidnappers.org.nz. Thanks to New Zealand On Air for making this program available through funding the Access Internet Radio project.
You're listening to Radio Kidnappers, the voice of Hawke's Bay. This is a program called Acupuncture on Air, and as always, it's our pleasure to have on the hot seat Heiko from the Acupuncture Clinic in Hastings. How you going, Heiko?
I'm really good, Ken. And what about this glorious weather here in Hawke's Bay? And
sun is shining. And
that news today that Hawke's Bay is now the number one economic, growth place in New Zealand.
We live in a paradise. Who'd want to live anywhere else? We've got a special guest on the program today. It's
Hamish Reid from Melbourne. How you doing, Hamish?
Good, mate. Morning, Heiko. Morning, Ken, and to your listeners as well. Thanks for having me back.
You know, Hamish has recently been. He's done a little bit of a tour, shall we say, of New Zealand. He's been to Wellington and Christchurch, and teaching acupuncture, in particularly teaching in relation to treatment of musculoskeletal disorders. And how did that go, Hamish?
Yeah, it was really good, thanks, mate. I really had a ball delivering those workshops in Welly and Christchurch, and look, they're two really beautiful cities, and I've got to say, equally as lovely people. Felt really at home, very welcome there. So it was a really great experience all around, to be honest.
That's great. So just today we thought we'd just still keep it in the realm of musculoskeletal problems. So I'd like to just talk about tennis elbow today, because I don't know if your practice is like mine. I mean, it's an incredibly common problem, and not that I'm biased towards acupuncture, of course, but I do think acupuncture is probably the foremost treatment for it. And what about with you, Hamish? Do you see a lot of it?
Oh, absolutely, mate. This is, I mean, it's one of those things that more and more, people are just doing lots of things. They're taking on activities that maybe they shouldn't. But I think everyone, we see so many people like tradespeople and some tennis players, but sports players, receptionists, renderers, gardeners, all those people that we're always trained to sort of specialise and be really good in an industry, and these people do these things over and over and over again, and we're not sort of meant to. So that causes a lot of these kinds of injuries too. So yeah, a really big part of what I see too.
Yeah, and that's what I find is that I think I've probably only ever had two tennis players in my whole career who have had tennis elbow. Builders get it, people working in factories, and people just for no reason at all can seem to get it.
Yeah, absolutely.
So it doesn't just happen to people who are working manual jobs. It can happen to, say, an old DJ like me.
Yeah, well, absolutely. Anyone that that's right. Anyone that does repetitive activity, and like I said, we're not really designed to do so much repetitive activity, which is where the problem comes about in the first place. We try and take on things that and again, it might be like a repetitive strain as well, but there's that chronic wear and tear sort of situation over a period of time. But there's also people, you'd get this too in your clinic, Heiko, people that they don't really have a problem, but then suddenly they'll do something where they just go 100%. So they'll decide one weekend just to paint their whole house, or they'll move house, help a friend move house, or that kind of thing, or all those cut branches all day. It'll go 100% when their body may not quite be up to the task, and it'll be normally those intense activities that'll see them in our clinic the following day, I suppose.
That's right. Yeah.
What's the difference between, say, RSI and tennis elbow?
Well, look, that's tennis elbow. I feel it's a pretty loose descriptive term. Like it's like Heiko said. I mean, we don't get many people that play tennis at all getting tennis elbow. So I would call tennis elbow RSI, repetitive strain injury, just in that lateral side of the elbow too. So we can get RSI, that repetitive strain injury, anywhere on the body. Using the joint or the muscle where the body's not up to the task. So tennis elbow is really another form of repetitive strain injury.
No, I was just going to say what I'm finding is that in terms of Chinese medicine, we know that as we age, as we work harder, we lose our reserves of energy and blood, and for want of a better word, the muscles of the forearm and the biceps there, they get a little bit weaker, and so therefore then the attachments get a little bit weaker as well. And so then, if you're a builder and you're hammering away, and if you're over 40 and you suddenly, as you said, you decide to paint your whole house one weekend, and then bang, that little bit of attachment as it attaches there to the bone, bang, it gets it, and it can be extremely painful.
Now,
Absolutely.
Heiko's mentioned that he does electroacupuncture. Can you tell us a bit about that, Hamish, and what it is, how it works in relation to tennis elbow?
Yeah, for sure, Ken. Look, with in my experience, really, I mean, I do so much electroacupuncture in my experience treating tennis elbow. It's actually a must to use electroacupuncture. I feel personally it gives like a 2 or 3-fold improvement over just the needles alone. So electroacupuncture is really when we'll apply an actual pulsating electrical current to the needles. And look, we've got the goal there of encouraging those contracted muscles. And I think you mentioned, Heiko, in tennis elbow, it's the extensor carpi radialis brevis muscle, which we call the ECRB muscle. So that's responsible really for the pain of the tennis elbow and that attachment site that gets inflamed. So we're running a pulsating current through the needles. Now, I should say to your listeners, it's not really the kind of current that they may be thinking. It's a low-level current measured in milliamps. So I think if we compare that to the current we know, which is volts, there's around 1,000 milliamps in a volt. So we're only using a current of 20 to 30 milliamps. But I suppose by doing this, by sending a current through the muscle, we're encouraging that ECRB muscle in tennis elbow to relax. And if we can do that, that'll reduce the inflammation at that attachment site to the humerus bone, where that characteristic pain always sort of manifest. But yeah, I just feel electro gives a consistently great and a very predictable result for this kind of condition too.
Yeah, and I just want to reiterate too, that the electro, it can have that sort of reputation. Almost want to scare patients away, but it is a very, very mild, and patients often remark that it actually feels so relaxing. Some patients might say, "Oh, it feels a bit weird," right? But yeah, it's actually quite relaxing, and with that actually then the reduction in the pain.
Yeah, and I love to when the patients sometimes say the electro feels like a massage that your fingers just can't get to, and I love it when patients just feel that electro and they go, "Oh, that's right on the spot. That's exactly where it is."
Yeah.
So I wonder why both of you. Why don't you use electro needles all the time?
Well, I'll let you answer that one, Hamish. Yeah.
Oh, sorry. I was just going to say, look, there's sometimes electro can be, because with a lot of acupuncture, we're using up the body's reserves and using up the body's energy and blood flow as well. So sometimes, I mean, with high inflammatory cases, in my view, where the body's got a lot of energy and there's a lot of blood coming to the area, the electro has a sort of an anti-inflammatory effect as well. And so it does use up a bit of the body's energy, in my view, too. So those people that are really deficient or older people, especially it's contraindicated for pregnant people. So there's a few contraindications where we wouldn't use electro, but for a lot of musculoskeletal cases, I would use it. And sorry, Heiko, you were about to give your take on that as well.
Yeah. No, as I said, it's hard to sort of say, should use it for everyone or some people, but certainly in many of the musculoskeletal cases, it's very, very useful. I'm a bit more hesitant with elderly people, and that's why I use a lot of moxibustion as well. And again, sometimes moxibustion is not the ideal, and so you've got to really look at every case on a individual. Now, what about you, Hamish? Are you using much moxibustion?
I do actually. Yeah, look, I probably it is a tool that I use, and I know I've heard you love your moxa, Heiko, and rightly so. Look, it is a very effective tool. It's actually funny. It's funny talking about electro and then suddenly moxibustion as we're looking at the two opposite ends of the acupuncture timeline. Really, I think moxibustion is one of the most ancient techniques. I think it was like something like 580 BC or something like that. Whereas the electrostimulation, I mean, we call that very modern, but that was around the 1930s that was introduced. So it doesn't sound modern, but in relation to a 5,000-year-old medicine, it's pretty modern. But yeah, look, just for your listeners too, in terms of explaining moxibustion, if we take the two words moxa and bustion, moxa is basically referring to the moxa or the mugwort plant, and bustion obviously meaning combustion. So it's really the burning of this very hot mugwort herb over the acupuncture points, and that's going to have a really incredible warming effect, and that'll encourage vasodilation, and therefore we'll get a lot of blood to that tennis elbow muscle, the ECRB muscle. And look, if we can get good blood flow to the muscle, this is going to lubricate it, it'll give the muscle elasticity, and therefore it's going to promote, I suppose, not only relaxation, but energy and strength to the muscle. So, yeah, yet another great technique in our toolkit.
Yeah, what I always say to the patients, I say the moxa itself, and just again to let patients know that you're not actually burning the skin. It's near the skin, like you're applying the warmth. And patients will say, well, how is that herb different to, I don't know, burning sage or burning something else? And I haven't got an answer for that, except that I have spoken to Chinese physicians in China, and they say, look, it's something to do with that specific essential oil that somehow gets emitted through the heat of it, gets into the skin, that just has a different and the most beneficial effect.
Yeah, absolutely. I think I have a similar explanation to them, and I'll say something like sage and that. It's a warming herb, but moxa is in Chinese medicine, one of the hottest herbs you can get, so therefore that's got the most heat to be able to penetrate through the point and really warm and like to create that vasodilation and relax the muscle too.
Now, as you're probably aware, Hamish, that Heiko's getting on a bit, so he uses that sort of the classical and traditional approach to the needle techniques. A young fellow like you're more up to date. What are you doing different from Heiko?
So yeah, look, my main area, like I really love the integration of the modern stuff. Well, now I'm talking more modern than 1934 here with the electrode, but my main area of research and treatment now involves the stimulation of what we call the motor points, which, look, they are different to acupuncture points in the way that motor points are really the very site at which the actual motor nerve will innervate and stimulate the muscle. So it's really the direct site of the neuromuscular junction where the brain sends the signal to the muscle, telling it, obviously, to contract and relax. And look, I reckon it's really important to stimulate these sites as well, because if you think about it, in the case of tennis elbow, again, the brain's sending a signal to that ECRB muscle, and it's telling it to contract. If the muscle's agitated, it's inflamed, and really what we have to do is alter that signal so that the muscle receives the signal to relax. And like you said earlier, Heiko, this will take the pressure off the attachment side of that humerus bone. So we can do this through the needling and the electrostimulation of the motor point. And the real benefit of the motor point here, guys, it's going to have an immediate effect. And I suppose it has an immediate effect, it's going to have immediate relief. So it's a really effective technique to combine with our underlying Chinese medicine techniques. So I feel this is a really beautiful integration of both the Western science and the traditional Chinese medicine as well. And again, to me, I love that. That's what it's all about, to get the best result for the patient, the integration of the two.
I wonder what the old Chinese masters of acupuncture might think. So if you went to China with your techniques, Hamish, would they applaud you for that, or would they say, you're just a young fellow trying to change the world?
Yeah, probably a bit of both, I think. That's the funny thing. Look, I think at the end of the day, hopefully I'll be applauded because I'm still using some very traditional Chinese medicine techniques to treat the root cause of the problem, but I'm causing immediate relief with the more modern techniques as well. So again, a really
one
good
thing I do know with the motor is that some of the classical acupuncture points are also motor points in terms of their anatomical location. I do know with Matt Callison from the States, when he has lectured here in New Zealand, some of the points are classically also then, how would you say, confirmed up with the modern anatomical positions. What about you, Hamish? Have you found that?
Yeah, absolutely. And this is, again, the amazing thing I feel about Chinese medicine. That 5,000 years ago, without any MRIs, any scan tools, anything like that, they're mapping out the spots where motor nerve actually enters the muscle, which is quite amazing. So, look, we know there's, over 800 acupuncture points in the body. And so, look, a number of them are motor points, and this is why we'll get certain reactions or certain responses when we needle certain points. But a lot of the motor points where the nerve innervates, they're actually just off the acupuncture points, or they're sort of in between acupuncture points as well. So again, it's like, to me, it was like learning a new set of acupuncture points as well. But some of these motor point locations, they make a lot of sense given where the acupuncture points are too.
When you're doing your workshops, Hamish, do you find that people are receptive to taking on board what you're talking about? So, acupuncturists like Heiko, are they saying, yeah, that's a great idea, we're going to try that?
Yeah, you absolutely can. And that's the thing I love, I love helping sort of add these extra tools to practitioners' toolkits, and they are very well received because, practitioners are always after new ways to try and get better results for, some of these cases that have proven to be really stubborn in clinical practice. So it's really nice to be able to introduce a new concept to them and in a practical sense, guide them through it and get them getting some really good results as well.
Now, sorry, I've had my phone ringing here, and that's one of the first times I've used this, so it's distracted my my spleen energy there, Hamish.
Someone they couldn't hear it, Hamish, been going off a woman's show.
Yeah, but the other thing what I find that we here in New Zealand, and I'm sure it's the same in Australia, is that we're getting a little bit of how would I say, other practitioners starting to use a bit of needling, calling it dry needling, without any sort of real knowledge of needle technique, the ability to send the energy or the chi to go to the areas, and I'm finding that this is really limiting the effects of true acupuncture. So sometimes I get patients, that have said, I've already had the acupuncture, but then what they've had is, they've had some dry needling once, and it just caused bruising and pain. So it actually then ends up giving acupuncture a bad reputation. I presume the same's happening there in Australia and in Melbourne for you.
Well, look, that's right. I mean, look, the dry needling, like I said, a lot of physios and chiros might do the dry needling, and look, to be honest, look, as far as acupuncture goes, and they've sort of got their techniques to release muscles and do their own thing, but as far as acupuncture goes, yeah, we're treating, I mean, we could say we do some local needling in some acupuncture points or trigger points. That's also, treating locally and that kind of thing. But as acupuncture, we're all about treating the root cause, and that's the main difference. Dry needling, we could sort of treat someone's tennis elbow and just stick needles in the points that are sore, but we're not really looking at identifying what the cause is and how to actually treat the cause. And I think that's the main thing about the acupuncture. In my view, the acupuncture will be the thing that will prevent it from actually returning, which is what the patient wants.
Yeah, and so that's what I find when I say to patients, we want to treat the root cause. We want to treat your deficiency or your weakness or your, why have you become in this weakened state to allow that injury to happen.
Exactly.
And then if we build up the life force, the energy, the chi and blood, whatever term you want to use it, to promote, I don't like to use the word, but promote healing in the body, which then, gives the recovery of the injury so much more.
What would be the cause? I mean, Heiko often says that if you've got a headache, it's something to do with your kidney or your liver. So what would be the root cause of tennis elbow, Hamish?
So, again, Ken, there's quite a few, but I think if we look at root cause, I think I'll need to give you the short version. We probably talk about the foundations of acupuncture all day, given it's a 5,000-year-old medicine. But look, I suppose just, again, the shortest version I can give, I mean, many of your listeners would know about the concept of the acupuncture meridians, and they all follow a certain pathway through various muscles and tissues and organs and limbs, and their function in China, from a traditional viewpoint, is to circulate blood and, like Heiko said, energy through the meridians to stimulate those regions, and look, from that way of looking at it, from that traditional sense, trying to mix it with Western, I mean, every cell, every tissue, every organ, bone, muscle, skin, hair, all those kind of things are nourished and energized and have the ability to grow and develop and function because of that free and uninhibited flow of blood and energy. And as we also know, each of these meridians tend to connect to and it gains their functionality from a specific organ. So, again, we've got the lung meridian, the spleen, the heart, the kidney. So going back to tennis elbow, like in the case of tennis elbow, it's the meridian related to the large intestine normally that'll traverse that lateral elbow area and that ECRB muscle and the brachioradialis. So it's the large intestine, the flow of energy and blood there that gives functionality to that muscle. So, funny, when you mentioned before, Heiko, that people don't need to really play tennis to get tennis elbow, I agree. They actually don't need to play sport or do anything with their arm, because it may, and it normally does stem from an underlying issue with the large intestine. if we look at the root cause of the problem, unless we can treat the large intestine, it'll really just be a Band-Aid solution, and that tennis elbow is going to keep being aggravated because we haven't addressed the cause. And you'd be familiar with this too. I find it awesome. A patient will come in, asking for help with tennis elbow, and I'll ask things like, well, do you get any issues with irritable bowel or constipation or that kind of thing? And they'll say, well, how on earth did you know that when I've come for my elbow? And it's basically just the imbalance in the bowel that may cause a weakness in that ECRB muscle, which will then in turn become aggravated, inflamed because of that activity due to an underlying pathology. So, yeah, look, really, if they want the pain to stay away, we have to work on the bowel and the dietary and the emotional concerns, which are all a big part of it too.
That's great. But listen, we're just getting very short on time here. We need to be finishing up now, and as I said, I'll be finishing up usually with a song. And I've got 10 out of 10 from Ken today for the song I've picked. Is "I'm a Believer" by the Monkees. Little bit of recognition to Peter Tork, who passed away not that long ago. Yeah, but just before we go, Hamish, can you just tell us where you are, or maybe your phone number in Melbourne if people want to catch up with you?
Yeah, absolutely, guys. I'm in Burwood East in Melbourne. My clinic, Reid Health Integrative Medicine. The phone number, the area code 03, and it's 9802 7000. The phone number there in Australia. So look, once again, I've still got to make it up to Hawke's Bay to try one of your nice Merlots up there and have a look at your beaches and that too. But again, thanks for having me, guys. It's been great fun.
That's great. Well, we'll organise. We've got enough practitioners up here to do a seminar. So you might have to put Hawke's Bay on the tour map next time.
Yeah, I don't need any convincing for that, mate.
All right, that's great. Well, you take care, and we'll see you up in Hawke's Bay.
Will do. Thanks, guys. Appreciate it.
Okay, Hamish. Cheers.
See you later, mate.
Okay, bye.
And before we go, Heiko, just remind our listeners, if we want to come and see you for any acupuncture, where are you?
I'm in Hastings at 206 Charles Street. The clinic is called the Acupuncture Clinic. I'm just across the road from the Pack and Save there.
Here's the Monkees.
I thought love was only true in fairy tales, and for someone else, but not for me. Our love was out to get me, that's the way it seemed. Disappointment haunted all my dreams. Then I saw her face, now I'm a believer. Not a trace of doubt in my mind. I'm in love, I'm a believer. I couldn't leave her if I tried. I thought love was more or less a given thing. It seems the more I gave, the less I got. What's the use in trying? All you get is pain. When I needed sunshine, I got rain. Oh, then I saw her face. Now I'm a believer. Not a trace of doubt in my mind. I'm in love. I'm a believer. I couldn't leave her if I tried. That's the way it seemed. Disappointment haunted all my dreams. Oh, then I saw her face. Now I'm a believer. Not a trace of doubt in my mind. I'm in love. I'm a believer. I couldn't leave her if I tried. Yes, I saw her face. Now I'm a believer. I'm not a trace of doubt in my mind. Said I'm a believer.
This program was produced by and first broadcast on Radio Kidnappers, a volunteer-based community access station. For more information, go to www.radiokidnappers.org.nz. Thanks to New Zealand On Air for making this program available through funding the Access Internet Radio Project.